In Australia, 80% of children 12 and above have received their first dose of vaccine, and actually 50% of children 5 to 11 have received their first dose of vaccines. So we still have some way to go to make sure that all our children are protected against COVID-19. We strongly support using vaccines in children to try and prevent the harms of COVID, but it is also important to remember that this is a group that have a lower risk of complications from COVID compared to other groups we vaccinated early. So our primary target is to make sure that all those children receive their 2 doses first. It is possible that we'll be boosting children in the future, but we're not there yet in Australia. That's a really good question. So for example, a child who is 11, just before their 12th birthday, who's being vaccinated, should receive a paediatric vaccine. We would normally recommend an 8-week gap between their first and second vaccine, but if they are 12 by the time they're due for their second vaccine, they receive an adult dose. This will be relevant if we do use boosters in children, because there may be children who were 11 at the time of their primary course and 12 at the time of their boosters. Importantly, if that occurs, we use the dose recommended for 12-year-olds. Unlike earlier strains of COVID, where 2 doses were providing very good protection against both infection and severe disease, we are seeing that Omicron, that 3 doses are required, and that's why everyone 16 and above is recommended to get a booster. Importantly, we are seeing some waning of that immunity. However, it is not yet certain whether 4th doses will be required. Clearly, we're learning lots as we roll out our booster strategy across Australia and internationally, and we're looking at this very carefully to inform whether a 4th dose will be required. But at this stage, we do not believe in Australia that's necessary, but this is a changing field, and importantly, it may continue to change and advice may change accordingly. So Omicron symptoms are very similar to all COVID symptoms. Children with COVID usually present with fever, with cough, sometimes runny nose, headache, muscle aches. What we do know about Omicron is symptoms in general are milder than previous strains, which should be reassuring to all parents and adults out there. Some children are presenting with specific illnesses such as croup and bronchiolitis that we see with lots of respiratory illnesses in childhood. And importantly, some children may be completely asymptomatic with their Omicron infection. But most importantly, Omicron is presenting very similar to other respiratory illnesses with fever, cough, headache, muscle aches and pains.